Welcome to the Lump Lecture Series featuring Xi Cleft Points, presented by Lump AccuWellness Foundation, Inc. Xi Cleft Points, also called the accumulation points, are all located between the fingers or toes, elbows or knees, with the exception of stomach 34, Yangqiao, which is above the knee. The term Xi means crevices, and this refers to the fact that the accumulation points are located in crevices where the Qi of the channels gathers and concentrates to plunge deeper from the superficial layers of the channel. They are points where the Qi of the channel gathers and are used mostly in acute patterns, especially when there is pain. They are therefore primarily indicated for channel problems and are usually reduced as they are mostly used for excess patterns. Another characteristic of these points is that they can be used to stop bleeding, especially in acute cases and especially for the in channels. For example, lung 6, Kong Choi, is frequently used for an acute attack of asthma. Stomach 34, Yangqiao, can be used for acute epigastric pain. Spleen 8, DG, for acute dysmenorrhea. Bladder 63, Qinmen, and liver 6, Chongtu, for acute cystitis. The clinical application of the accumulation points is briefly as follows. Lung 6, Kong Choi, important point for acute asthma and coughing of blood. Large intestine 7, Wen Liu, for acute or painful syndromes of large intestine channel. Stomach 34, Yangqiao, acute and or painful syndromes of the breast, knee pain, acute epigastric pain. Spleen 8, TG, acute painful period, excessive menstrual bleeding. Heart 6, Yinqi, severe heart pain, acute and bleeding. Small intestine 6, Yang Lao, severe pain of shoulder and scapula, eye diseases with pain. Bladder 63, Qin Men, painful hernia-like disorders, acute cystitis. Kidney 5, Shui Tran, blood in the urine, painful periods. Pericardium 4, Semen, severe chest pain, nosebleed, vomiting of blood, coughing of blood. Sanjiao 7, Hui Chung, pain in the arm, useful in post-viral fatigue syndrome. Gallbladder 36, Wai Chiao, pain along the gallbladder channel. Liver 6, Chong Tu, painful periods, excessive menstrual bleeding, painful urination. In addition, there are 4 accumulation or Xi Cleft points for 4 of the extraordinary vessels, the Yang and Yin stepping vessels and the Yang and Yin linking vessels. These are bladder 59, Fu Yang, for the Yang stepping vessel. Kidney 8, Jiao Xin, for the Yin stepping vessel. Gallbladder 35, Yang Qiao, for the Yang linking vessel. Kidney 9, Chu Bin, for the Yin linking vessel. The Qi of the extraordinary vessels accumulates at these points, which makes them particularly powerful points to activate the qi of these vessels. They can be used in combination with the opening points of the extraordinary vessels. For example, the point bladder 59, Fu Yang, is used for sciatica on the lateral side of the leg in combination with bladder 62, Shen Mai, when there is pronounced stiffness and inability to walk properly. The Xi Cleft points were first discussed in the systematic classic of acupuncture and Mok Sebastian. The term Xi implies a cleft, crevice, hole or opening, and the Xi Cleft points are where the qi and blood, which flow relatively superficially along the channels from the Yinwei points, gather and plunge more deeply. The Xi Cleft points in general are indicated in the treatment of acute conditions and pain, whilst the Xi Cleft points of the Yin channels have an additional action of treating disorders of blood. These theoretical concepts are clearly demonstrated by the clinical applications of these points. Kong Choi, lung 6, is an important point both for acute diseases of the lung and for disorders of blood. It was traditionally indicated for attack by exterior pathogenic wind heat or wind dryness, giving rise to febrile disease, acute cough and wheezing, swelling and pain of the throat, and loss of voice, and for coughing blood due to any etiology. In modern clinical practice, the principal use of this point is in the treatment of acute cough, wheezing, or asthma of any pattern. Wenliu, large intestine 7, is indicated in the treatment of acute disorders and pain affecting the large intestine channel, and can clear heat and detoxify poison in cases of clove sores, carbuncle and furuncle, throat painful obstruction, and heat and swelling of the face. Yangqiao, stomach 34, is unique among the Xi Cleft points of the 12 channels in being located proximal to the knee or elbow. The stomach channel passes through the breast and nipple, and Yangqiao, stomach 34, is traditionally indicated for acute disorders such as breast pain and breast abscess. In modern clinical practice, it is also used for acute epigastric pain. TG, spleen 8, has an important action on resolving blood stasis in the uterus and lower abdomen, and is indicated in the treatment of dysmenorrhea, especially when acute, irregular menstruation, and abdominal masses in women due to this pathology. Yin Shi, heart 6, is indicated for severe and unbearable heart pain due to blood stasis, and for bleeding disorders due to excessive heat agitating the blood. In current practice, however, semen, pericardium 4, the Xi Cleft point of the pericardium channel, is more used for acute heart pain. The relationship of Yin Shi, heart 6, to blood is also expressed via its effect on treating disorders of sweating. Yang Lao, small intestine 6, is indicated for pain of the shoulder, scapula, and arm that is so severe that it feels as if they are broken or dislocated. It is also used as a distal point for acute contraction and sprain of the lumbar region. Qin Men, bladder 63, is indicated for sudden onset Shan disorder, sudden turmoil disorder, acute vomiting and diarrhea with cramps, epilepsy, and white tiger joint pain, which is intense pain due to painful obstruction. Shui Chuan, kidney 5, is indicated for a variety of menstrual disorders such as amenorrhea, irregular menstruation, dysmenorrhea, and delayed menstruation, characterized either by deficiency of blood or stasis of blood. Semen, pericardium 4, is the primary point for treating acute stasis of blood in the chest and heart, giving rise to pain. It is also indicated for hot, reckless bleeding in the upper jaw, manifesting as nosebleed and vomiting or coughing of blood. Hui Tsung Sanjiao 7, or triple burner 7, has no relevant indications and seems to have been little used in classical practice. Wai Chiu, gallbladder 36, is indicated for painful skin associated with painful obstruction and atrophy disorder, as well as for rabies. Chong Tu, liver 6, is indicated for stasis of blood in the uterus, Shan disorder, and lower abdominal pain. Fu Yang, bladder 59, is the Xi Cleft point of the Yang motility vessel, but has few relevant indications. Jiao Xin, kidney 8, is the Xi Cleft point of the Yin motility vessel and is indicated for irregular menstruation, dysmenorrhea, amenorrhea, and especially for uterine bleeding. Yangqiao, gallbladder 35, is the Xi Cleft point of the Yang linking vessel, but has few relevant indications. Chu Pin, kidney 9, is the Xi Cleft point of the Yin linking vessel and is traditionally indicated for acute and severe mental disorders such as madness, mania depression disorder, raving, fury and cursing, vomiting of foamy, watery saliva, and tongue thrusting. Many modern texts describe the cleft points as being in areas where the channel pathway narrows and has a tendency to blockage and an accumulation of qi and blood. A more clinically useful conception would be areas where channel qi is filtered and flow is controlled. The cleft points are like sluice gates or toll booths, regulating the nature and rate of channel flow. As might be expected, these points are often found in areas along the body surface where an opening or clear separation can be readily palpated. Sometimes these palpable openings are between the bodies of muscles, or in many cases, between small bones. There are a total of 16 cleft points, one for each of the 12 regular channels, plus the Yin-Yang-Chao vessels and the Yin-Yang-Wei vessels. While the cleft points have the ability to regulate the flow of qi in the channels, it is important to remember that they are by no means the only points with this ability. The type of flow regulation thought to be occurring at different points along the channel varies. Understanding the nature of that variability comes from considering the point categories. For example, the source points are where the prenatal source qi enters the channels. If the cleft points are likened to stoplights along the highways of the channels, then the source points may be likened to gas stations. To extend the metaphor, the collateral points may be likened to regulators along the small side roads of a complex road system, while the growth of Qi transformation among the 5 transport points may be represented by ever-increasing speed limit signs along increasingly wide highways. While this metaphor may be helpful, it is important to remember that changes in the nature and rate of channel flow can be effected to some degree at all acupuncture points. The value of point categories lies in the ability of these general groupings to help direct the practitioner to some of the most useful points on the body and to describe ways of visualizing how to creatively use these points in the clinic to affect physiology. The cleft points have 2 general functions, both of which are most applicable in relatively acute cases in which pain is part of the symptom pattern. Number 1, facilitate the movement of Qi to alleviate pain and eliminate swelling. This is the most common use of the cleft points and refers to unblocking channel circulation in cases where lack of free and open circulation has led to pain. This function of the cleft points is especially relevant on the yang channels, as these channels and their associated organs require constant movement for optimum function. Number 2, redirect counterflow to stop bleeding. These are cases where counterflow Qi in the channel has led to a kind of stagnation. The stagnation in turn has built up in the channel and has led to bleeding or bruising. The cleft points can be used to unblock the circulation, reduce stasis, and slow the rate of bleeding. The net result, somewhat counterintuitively, is an increase in channel circulation that actually reduces bleeding or bruising. This function often applies to the cleft points of the yin channels, as these are the ones which tend to produce, direct, and nourish the blood. Thank you very much for your attention. See you in our next videos.